Hello, this is Lindsay Lopez from Southeastern Physical Therapy. I'm joined today by Sam Robinson from the Jordan-Young Institute. Dr. Robinson, how are you?
I'm great, thanks. Thanks for doing this with us again.
Yeah, absolutely. So I'd like to talk with you a little bit about knee replacements. Can you talk briefly about what a knee replacement is?
Sure. As you know, knee replacements are something that we're doing more and more of these days. They're great surgeries, but they are big surgeries, and so it is something that people sometimes have questions about. Basically, when somebody has significant arthritis and their knee is worn out, we can replace it, and we put a metal and plastic to replace the parts that are worn out. It's a good-sized surgery, but we do them so frequently, we're pretty good at minimizing the risks.
Okay. So how can a patient prepare for a TKA or a total knee arthroplasty?
Yeah. So once somebody's gone through all the initial steps of trying injections and the conserve measures, and they get to the point where they're thinking about knee replacement, one of the things we try to do is make sure that they go into the surgery as well prepared as they can. We want to make sure they've got as good, their motion as good as it can be, that their strength is as good as it can be, that they've got the support they need at home, and they've kind of taken precautions to make sure that their house is as safe as it can be, so they might not have any falls or anything like that. So a lot of times people would benefit from doing a little physical therapy before surgery, just to make sure that we're doing everything we can to make the surgery as safe as possible once we get the surgery done.
Okay. What can a patient expect after their total knee replacement?
The therapy is the key to a successful recovery. The knee replacement is as I said, a big surgery. It can be painful, but we're pretty good at managing the pain. We use what we call multi-modality pain control. So we kind of attack the pain from a lot of different angles and perspectives. And in doing so, we're able to get the pain under control and hopefully do well with the physical therapy. Therapy is the key, and the therapy starts in the hospital. Sometimes the day of surgery, we get people walking in the hospital the day of their surgery. It continues with home health, where they typically get therapy at their own house, with a therapist coming to their house. And then once they're safe and they can get around the neighborhood a little bit, then we get into outpatient physical therapy. And that really just continues until the patients are recovered. And that's different for every patient. Sometimes people will go through a little bit quicker. Sometimes it takes them a little bit longer. The key is just getting the end result where you need to. And therapy really is the key to doing so.
Okay. So you've touched on this a little bit, but just to kind of talk about it a little bit more, how can patients best optimize PT?
Yeah, I mean, I think that one of the things is having a therapist that's going to work with you regularly, somebody that knows you real well, and obviously through the course of this can continue to know you, to kind of push you a little bit. Obviously, working hard with the therapy isn't always the most comfortable thing, but the therapists are really, really good at making sure that they work hard, but also understand the difficulties that come with it. And then one of the big things is keeping that pain under control so that we can have success with the therapy. And that really is our role. We want to make sure that we're communicating well as a team. Both the physician, the physical therapist, and the patient are all working together as a team to keep the pain under control, work hard with the physical therapy, and obviously troubleshoot any problems that come up along the way.
Okay. So before I let you go, can you remind me where you guys are located and how a patient can best set up an appointment with your office?
Yeah, we're at the Jordan-Young Institute. Our address is 5716 Cleveland Street, Suite 200 in Virginia Beach, and our phone number is 757-490-4802.
Okay, awesome. Well, thank you so much for your time today. I appreciate it.
Thanks so much, Lindsay. We'll talk to you later.